Hello and welcome to the WIHS Journal program. I'm Jack Pike, and my guest today is Dr. William Lile, who is board certified in obstetrics and gynecology. He is licensed to practice medicine in both Florida and Alabama and has delivered over 5,000 babies. He has been an instructor with the University of Florida and the Florida State University OBGYN residency programs. In 1999, the practice that he took over was the largest provider of abortions in Pensacola, Florida. All abortions were stopped on day number 1, and the Ministry of Pro-Life Doc was born. He serves on Focus on the Family, Physicians Resource Council, and is a frequent guest on TV, radio, and podcasts. This year, he developed the 8-hour Pro-Life Doc video curriculum as a resource for all defenders of God's preborn, titled, quote, "A Patient is a Person, no matter how small," unquote. Dr. Lile, welcome to the program.
Well, Jack, it's an honor to be with you and your audience.
Thank you. So getting us started today, how are you defending the rights of patients?
Well, all patients have rights. First, when it comes to good government, the role of good government is to protect its patients and to protect its citizens. All 50 states and the federal government has laws that protect the rights of all patients. And do patients have rights? Absolutely. Do patients not born in the United States have rights? Absolutely. Do patients not born in the United States yet have rights? Absolutely. And over the past 20 years, we haven't just gone from diagnosing babies. We are now actually treating babies and curing babies in the womb. Everything from giving them blood transfusions, correcting heart arrhythmias, even performing open heart surgery for babies in the womb where the babies actually have their own anesthesia team and their own IV, and we're removing tumors from their beating hearts. But there's something new every single month that we are doing to save the lives of babies in the womb. So a patient is a person no matter how small, and the babies in the womb are my patients just as much as the moms are my patients. I've done thousands of hysterectomies. The mom always has a anesthesiologist, but never have we provided a second IV and a second anesthesiologist for the uterus. Why? Because the uterus is truly part of the mom's body. And if the mom is comfortable, we don't have to worry about the uterus. But when we are performing surgeries on the babies in the womb, we actually have separate anesthesia teams just for the baby. From that moment of conception, half the time that baby is a different gender from the moment of conception, but babies can even have different blood types from the mother. And because of the fact that they are different patients with different blood types, sometimes there are conditions where the moms will have antibodies which can cross the placenta and start to attack the baby's blood count. And if we don't intervene, that baby could die. So we can actually take blood that somebody donated to the Red Cross or One Blood, take blood from them, put it in a syringe, guide a needle with an ultrasound through the skin of the mom, through the wall of the uterus, go right up to the umbilical vein, and give that baby a life-saving blood transfusion. So clearly, they are patients, and all patients have rights.
Of course, we've gone now from the physical abortion to the use of the abortion pill. So talk about a little bit of that, about the prevalence and use of the abortion pill, as well as some of the dangers with the abortion pill usage.
Sure. Well, the abortion pill was first introduced in France and China in 1988 and in the United States in 2000. And it has rapidly become the fastest growing form of abortion here in the United States. In fact, estimates are between 65% and 70% of all the abortions are performed with the abortion pill. Now, there's a difference between the abortion pill and the morning after pill. I mean, they're both evil, but the morning after pill is indicated for 72 hours after a woman's had, her last intercourse. The abortion pill will kill a baby in the womb up to sometimes 12 weeks gestation, 98% of the time. In just the United States, almost 700,000 abortions are performed each year with the abortion pill. And there's lots of dangers, not only to the baby, but there are true dangers to the life and health of the mother as well when she uses the abortion pill. When the abortion pill was first approved, we were told that the risk of a complication for the mom was going to be less than 0.5%. A large study produced and written by the Ethics and Public Policy Center, just released last year, they looked at 865,000 women who had been prescribed the abortion pill. And then they further looked through their insurance information to see what kind of side effects occurred to them and complications after they took the abortion pill. Of the 865,000 women, there were over 94,000 women that had either a severe or a life-threatening complication. 40,000 women had to go to the ER. 28,000 women had severe bleeding. 24,000 women had to have surgery because they still had not passed all of the products of conception, the baby and the placenta. 12,000 women were diagnosed with either infection or even sepsis, and there were 3,000 cases of women who had an ectopic pregnancy. So the risk of a severe or life-threatening complication was actually 11%, not 0.5%, 22 times higher than what we had been told. So the number one killer of women in the first trimester of pregnancy is a ruptured ectopic pregnancy, and statistically, 1% of all pregnancies will be ectopic or tubal. That's why they had over 3,000 women who were diagnosed and had to be treated for an ectopic pregnancy after taking the abortion pill. Positive pregnancy doesn't tell you where the pregnancy is. You need an ultrasound. 1% of the time when a woman is mailed the abortion pill combination, 1% of the time, 1 out of 100, that pregnancy will be ectopic. And they're told, you're going to have bleeding, cramping, and pain when you take these pills. What are the symptoms of a rupturing ectopic? The exact same. So women are being harmed and women are dying because of the abortion pill. That is not good health care, and women deserve better.
How can pastors and priests become better equipped to discuss the issue of abortion from their pulpits? And we're also looking at how do we change the hearts and minds of our young people regarding abortion?
Well, we started a college-wide, nationwide tour called Abortion is Not Healthcare, and we are booking lots of college events to show them the truth, and that's what we're supposed to do. Show them the truth, and the truth will set you free. It's great having obstetricians. It's great having politicians engaging in the battle for life, but this is a spiritual battle, an attack on the image of God, so it needs to be our priests and our pastors that are leading this battle. Statistically, between 18 and 24% of the men and women in our congregations have personally been involved with an abortion. They are hurting. They need healing. Healing comes from forgiveness, and true forgiveness only comes through the gospel and the blood of Jesus Christ, which is why we need to hear from our priests and pastors that, number one, abortion is wrong. It's an attack on the image of God out of a hatred for God, but that there is healing available, and that is through the message of the gospel, and that should be the priority of all churches. Share that healing that is available through the gospel of Jesus Christ. We have a curriculum. We have actually videos that are specifically for churches. If you go to our website, which is prolifedoc.org, and go to Sanctity of Human Life Sunday videos, there are videos that are 3, 7, and 11 minutes long in English, Spanish, and French that are perfect for showing in the congregation. We also have a curriculum, which is now 10 chapters in length, which goes into a lot more detail than this. It is perfect for homeschoolers, Catholic schools, private schools, Sunday schools, people who just want to have more tools that they can use to be understanding of the issue of abortion, but also that they can engage. We don't want people just to say, I'm pro-life. We want them to be able to articulate why they are pro-life and be able to win the hearts and minds of our young people and adults regarding the issue of abortion.
Dr. Lile, thank you so much for your time. We appreciate hearing all about this.
Well, God bless you, my friends. Feel free to call me anytime, and people can contact us through prolifedoc.org.
You have been listening to my interview with OBGYN physician Dr. William Lile, addressing the physical and spiritual aspects of abortion. The website to contact him is prolifedoc.org, or call WIHS at 860-346-1049. For WIHS News, I'm Jack Pike.